You're looking directly at the lower part of the brainstem, the medulla oblongata, which connects the spinal cord to the pons. Externally, the medulla is divided into an upper open portion, where you can see part of the floor of the fourth ventricle, and a lower closed portion, which surrounds the central canal. On the ventral, front, surface of the closed medulla you'll notice a deep anterior median fissure running down the midline. Lateral to that are two prominent ridges called the pyramids, each formed by the corticospinal tracts carrying motor commands from the cerebral cortex. At about the lower third, most fibers in these pyramids decussate crossover to form the pyramidal decussation. Just lateral to each pyramid sits the olive, a rounded swelling caused by the underlying inferior olivary nucleus. Between the pyramid and olive you can make out the ventrolateral sulcus, where the rootlets of the hypoglossal nerve, cranial nerve 12, emerge. Lateral still, at the olive's posterior edge, you'll find the dorsal, post-olivary, sulcus giving rise to glossopharyngeal, 9, vagus, X, and accessory, 11, nerve rootlets. Turn the medulla around to view its dorsal surface. In the open medulla, the floor of the fourth ventricle slopes up toward the cerebellum. At the midline is the narrow posterior median sulcus. On either side of this you'll see the gracile and cuneate tubercles bumps formed by the underlying gracile and cuneate nuclei, which receive fine touch and proprioceptive input from the lower and upper body respectively. Lateral to the tubercles, the inferior cerebellar peduncles link the medulla to the cerebellum, carrying both afferent and efferent fibers. Internally, a cross-section of the closed medulla reveals a central canal surrounded by gray matter. Anteriorly, the paired pyramids contain descending corticospinal fibers. Just lateral, the inferior olivary nucleus appears as a dense cluster of gray matter, its fibers climb back up to the cerebellum. Dorsally, the gracile and cuneate nuclei lie beneath their corresponding tubercles. In the open medulla, the floor of the fourth ventricle houses several cranial nerve nuclei in reticular formation. Medial to lateral you'll find the hypoglossal nucleus, the dorsal motor nucleus of the vagus, and the solitary nucleus. Lateral to those lie the vestibular and cochlear nuclei receiving input from cranial nerve 8. Interspersed among these are interneurons of the reticular formation coordinating arousal and autonomic functions. White matter tracts course through the medulla as well. The medial lemniscus carries secondary sensory fibers from the dorsal column nuclei toward the thalamus. Anterolaterally, the spinothalamic tracts ascend. And ventrally, the pyramidal tracts descend before decussating. The medial longitudinal fasciculus runs near the midline, integrating vestibular and oculomotor signals for gaze control. Blood supply comes primarily from branches of the vertebral and posterior inferior cerebellar arteries. Lesions in distinct vascular territories produce characteristic syndromes: Wallenberg's lateral medullary syndrome from pica infarct, and medial medullary syndrome from vertebral or anterior spinal artery infarct. Understanding these external landmarks and internal nuclei will guide you as you localize lesions, interpret clinical deficits, and appreciate the medulla's vital role in motor control, sensory relay, and autonomic regulation.